nation, our provinces carry exorbitant cost of training South African doctors in Cuba. The Health Minister, Dr Joe Phaahla, admitting as much in Parliament that it costs twice as much to train medical students in Cuba than in South Africa. Now, South Africa has been sending medical students to Cuba since 1997 under the Nelson Mandela Fidel Castro training program. Dr Angelique Coetzee is the chairperson of the South African United Business Confederation Health Committee, and she joins us now for this conversation. Dr Coetzee, thank you very much for your time. So, the provinces buckling under the weight of this program in terms of financing these studies by medical students. In your calculations, how badly affected are the provinces here?
Good morning, Chloe. Yeah, very important question. Yes, they are quite badly put on the spot here. If you look at the cost, it's around about 2.1 million over the course of training them overseas. Remember, when they come back to South Africa, they still need to reorientate it themselves and redo their final year. Then they need to do their 2-year intern, and only then community service, and then they can go into private practice. And the first year, while studying in Cuba, they first need to learn Spanish. So these children are having quite a long journey before they are actually being allowed to practice in South Africa as a medical doctor outside of a public sector scenario. So this brings the question to mind: if we can use those monies better in our own country, and remember, we are under severe financial strain, the healthcare as well, and update our tertiary and secondary institutions, our learning institutions, as well as trying to take what is the best from the Cuban curriculum, because there are good things in the Cuban curriculum, but it's highly cost and ineffective for South Africa. Rather keep the money here from a business point of view.
So what is the major difference, Dr Coetzee, between institutions in South Africa and how they train doctors versus the institutions in Cuba? I'm simply asking about value for money.
Yes. So in South Africa, you need to understand we are going to move into national health insurance, and we keep on saying universal health coverage is the most important target that we need to achieve under the funding of national health insurance. So universal health coverage is very much primary healthcare orientated. So that the students training in Cuba is most of them are, or that the training course is very much based on primary healthcare and how to look after communities. Now, if you look at the South African system, and this is one of our biggest complaints especially from the private sector, where we see these youngsters coming into the private sector, is that our system is very much tertiary driven, hospital driven, specialist driven, and less focus on primary and preventative medicine. And this is a flaw that we have in our country. That's why I'm saying we need to take what is the best from the Cuban program, implement it here, keep the money here, change the curriculum, the undergraduate curriculum, to be more primary healthcare orientated, especially, as I've said, this is part of NHI, it's primary healthcare driven, should be, and with the current South African trained doctors, we are going to have difficulties. Then the next thing that we also need to look at, and this again from the SAUBC, this is one of the targets or goals for next year that we have identified, is to start looking at how can we train our post-ComServe doctors, whether they want to go into public sector or private sector, to help them with practical skills, very much looking at the Royal College of England's model before you go into private practice, because we have again seen that these doctors are not well equipped for primary health care outside a hospital system. So not everything is bad from Cuba. Let's take what is positive, but please keep the money in the country. We can do much better in the country with this money than taking these students out of the country.
What's confusing then about this training that the medical students receive from Cuba is that when they come back to South Africa, they have to be trained again.
Yeah.
Explain that to us.
It is because Cuba doesn't have a lot of HIV and TB cases. So when these students come back, we in South Africa, we are seen as one of the leaders in HIV and TB cases in the world, and we need to train these students again to understand the clinical picture, the importance and the impact of HIV, TB with other non-communicable diseases. So that's the one problem that they need to be trained. And as I've said, they are trained primary health care, while our students here are much more trained to refer to specialists and to treat in a hospital. So there's a huge difference. And as I've said, then if they are out of the training and post-ComServe, we also see a problem because they're not very well trained, even if they have been retrained. And now I'm not talking only about the Cuban, I'm talking about the student or the doctors in general, to be able to generate their own work outside of a hospital. We know that there's not enough money in the hospitals currently to appoint these doctors as medical officers. So what are you doing? You're training all these people. You don't have enough money. Rather bring that money back into South Africa, prepare these doctors for post-community service jobs, and then change our undergraduate training to be much more in line with primary health care than hospital-centric. And this is where the poor Cuban doctors coming in, that they have an advantage on that, as I've said, but not enough training on HIV and TB. They need to retrain because we are hospital-centric driven in our country.
Dr. Angelique Coetzee, let me thank you very much for your time and ongoing conversation. Indeed, thanks and thank you to Dr. Angelique Coetzee. She is from the South African United Business Confederation Health Committee, explaining some of the intricacies around sending our medical students to Cuba.